Health, right? The holy grail of any person, any family. Ask any rich person or poor person for that matter, right? What would they prefer? Would they prefer to be rich, opulently rich and powerful, but be sick all the time and die early, or would they, right, prioritize health? Right? Most people would choose health. Most people would choose to live a long and happy life, fulfilling and as much as possible free from any disease. Maybe you have some afflictions. Maybe you have had some diseases, of course. You'd have to be, I don't know, synthetic if you didn't have, right? But how much do you understand? How much do you understand the diseases or afflictions that you have? How much do you want to understand? How deep do you want to go? How deep is it necessary to understand one's affliction, one's disease? And what would be the benefit, right? I mean, why is it just not all right to just, treat at a very superficial level and address just the symptoms? And should that not be enough? Well, we're going to deep dive into this episode of the podcast, into these very things, because this whole issue, I mean, I've found myself talking about this with many patients, and I kind of repeat the same version of the same thing, and I'm tired of doing this. But at the same time, it's an incredibly important discussion to have, because what happens is that most of the time, most people, even though they do treasure health, what happens actually is that they go for a very superficial approach. They want to get rid of the disease and just be done with it, and just don't care about it, right? The problem with it is that if you go for the hedonistic approach, right, go for this pleasure-centered approach, I just want to throw away the suffering and I don't care about that, right? What's going to happen is that maybe you're not going to go deep enough, so that the problem is going to come back. And you treat it again, and then it comes back, and you treat it again, and then it comes back, and so on and so forth, right? So that's the problem, because if you don't treat it deep enough, then it comes back. That's only just a very shallow level of understanding disease. And I thought I'd start this podcast with the therapy part, with the right understanding, right? In Buddhism, we have this thing called right understanding of life, right? Of philosophy. Not that this is going to be Buddhist in any way, but it's not actually very far off. So let me tell you a story. I started learning acupuncture when I was 16 years old, and I discovered this amazing world in which this theory, this understanding of disease, this understanding of how things work, this understanding of why do we get sick and how can we make things better, was so fascinating, because first and foremost, it wasn't only about the physical body, it was about so much more, right? It was about the physical integrated with the mental, integrated with the emotional, integrated with the spiritual. So all these things were integrated into a whole picture, right? Therefore, it was very possible to have a physical disease caused by an emotional problem, or a spiritual problem, or a mental problem, right? Similarly, of course, you could have an emotional problem caused by misfunctioning of the physical. Now, the latter, right, the Western medicine understands. The first one, not so much, right? So when it comes to somatizations, that is translation of emotional problems into physical symptoms and diseases, that's where medicine, Western medicine, kind of breaks down. But you see, when I started out with acupuncture, I didn't know. And I was fascinated, and I was lucky because on one hand, I had my teachers on the acupuncture side, and on the other one, I had my grandma who was a nurse, and she was really sustaining me and supporting me in studying Western medicine, right? Western medicine was what I wanted to study in parallel with acupuncture. In my mind, I would actually practice them both side by side. And I was actually fascinated with the scientific approach, which, by the way, the scientific approach is both in acupuncture as well as in Western world, right? When I say scientific approach, I mean that it's pragmatic. It's based on what actually happens on the reality, on the objective reality that we can see, right? But there is a point where the approaches then diverge, right? Because the Oriental approach is, let's see the big picture first, and then understand what the role of each of the individual parts that we're trying to understand is in the bigger picture, and we derive its role and its meaning from the bigger picture. Whereas the Western approach is, we take something very complex, we divide it into small bits, we try to understand each individual bit, and we then put them back together, glue them together, hoping that the whole is the sum of each of the parts. Now that works for systems that are not very complex. The more complex a system is, the more synergy comes into place. And the more synergy comes into play, the less that can be said, right? The less the whole is the sum of its components. In very complex system, the more complex the system is, the more it happens that the whole is so much more than just the sum of its bits, which is why in a very complex system like the human being, the scientific approach only goes so far, because the synergy of all the little parts functioning together is lost when you try to cut it up, right? Imagine trying to understand life by putting something through a meat grinder, and then you look at what comes out the meat grinder, and it theoretically should be exactly what you put in, right? Except that life has just gone out when you've put it through a meat grinder. Sorry for the comparison, but that's actually exactly what happened. Anyway, so the story is, I was in this phase in which I was studying acupuncture, and I started studying when I was 16. I had 2 years before graduating and then passing my exam into medical school, and I was so fascinated with medicine. I studied really hard to get into medical school, and I got a really good grade into medical school. I entered 3rd out of 1,000 people. So I was really fascinated with Western medicine. And then, the first 2 years I was among top 5% in my class, because I was, again, fascinated with the human being, fascinated with the theoretical explanations, and everything was so amazing. It was interesting and fascinating to me. I even got into one of the most prestigious scientific circles, which was the neuroscience lab in the faculty of medicine. So I was really into science and stuff. And then came the 3rd year of medical school. And then it was a complete breakdown for me. And why was that? Because what happened was that I had such a great shock when finding out a few things that I'm going to share with you in a moment, that my grades went from 9 and 10 out of 10 to 6 and 7. Basically, I kind of thought, you know what, I'm just not into this so much, right? Now, what happened? Why this shock? What could have shocked anyone from being a top student into an average student? Well, basically, for me, it was pharmacology. And not only pharmacology, but actually in the 3rd year in medical school, you go into the hospitals and you see the actual applied medicine. And the theory, the difference between the theory and the applied medicine was so big, so huge, that I was, blown out of the water. Now, what was it? Well, for example, in treating the diseases, we were greeted, we the students, were greeted with an amazing fact. For more than 80% of all the diseases, there was no known cause. That was one of it. Secondly, right, so how can you cure something if you can't understand why it's happening? How can you attempt to treat it if you don't understand what's causing it? Now, of course, Western medicine is very, very good at symptomatic treatment, and that plays a huge role. I'm not against Western medicine. Please, I want to make this disclaimer very, very clear. I'm not against Western medicine. What I'm telling you was the epiphany that I had when I came to realize the not so nice side and not so well understood side of Western medicine. Because in the first 2 years, we were greeted with everything that Western medicine understands, right? We know this, and we know that, and we know this, and we know that, and we know the other, and fascinating, right? Until you get to the real world, and then the shit hits the fan. Because the idea is that when you do get into the real world, when you start to see that for most things that happen in the human body, for most diseases, for most imbalances, sometimes we don't even have a diagnosis. That was mind-boggling to me. Like, for example, take irritable bowel syndrome, right? Irritable bowel syndrome. Maybe you've heard of it. They actually taught us in medical school that this was kind of a fashion, right? Because a few decades before, the same thing had been called dyspeptic syndrome. Dyspeptic syndrome, right? This all sounds very complicated. It was on purpose, right? Because to a patient, right, it sounds like you're saying something. Now, okay, dyspeptic syndrome, like or after the fashion changed, it became, irritable bowel syndrome. The idea is that sometimes the bowels, basically the colon, the large intestine, is not even engaged in the pathology. It's the small intestine, not the large intestine, that's involved. And what was the peak for this kind of dynamic was that the idea was that it's not even having anything to do with the bowels, right? I mean, it's like, it's an exclusion diagnosis. It's like, how do you arrive as a doctor, right? How do you arrive at such a diagnosis? You exclude other diseases. It's like you have an algorithm of thinking, right? We doctors, that's what we learn in medical school. We have an algorithm of thinking, which is almost robotic. You can actually program a computer to do this. It's like, is this that? Yeah. No, yes or no. Is it this disease? 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 No. Okay, so if it's neither of all those, then everything else we stick into this big bowl and we call it, irritable bowel syndrome. Whether it's got anything to do with the bowels or not, who cares, right? We don't care. But basically, Western medicine says that it's not something serious because we've excluded everything serious. It's just a dysfunction. Okay, dysfunction, but your digestive system is completely out of sorts. Why? We don't know. What do we do about it? Not much, because we don't actually know what to do. You see, Western medicine is very, very based on structure. You have a broken bone, yes, we go in and fix it. You have something that needs to be cut out, yes, we go in and cut it out, right? When it comes to function, when it comes to something that cannot be seen, cannot be, seen on an MRI or a CAT scan or I don't know, X-ray or something, ultrasound, something, right? It's not structural, you can't see it. It's functional. Things start to go downhill, right? Because our understanding is very, very low when it comes to these kinds of things. But my disappointment didn't end here. I started to understand, because we were being taught this in pharmacology, the lingo of the doctors. Now, what do I mean by that? Like, for example, right, you have high blood pressure. You have high blood pressure, okay? And you know you have high blood pressure because, you know, you felt a little bit woozy and, you know, maybe dizzy and maybe some headaches and maybe some other symptoms. And somebody in your family comes and says, well, maybe you've got high blood pressure. And you take your blood pressure and lo and behold, it's high blood pressure. So what do? You make an appointment to see your doctor. And your doctor takes your blood pressure and sure enough, it's high. And then they write on this piece of paper your diagnosis. And you already knew you had high blood pressure. This was the presenting symptom. This was a symptom, right? I mean, okay, maybe you had only the dizziness, but if you're a little bit more intelligent than that, you could have taken your blood pressure alone. It's not a genius thing to take your blood pressure and see that it's high. But why is it high? Well, herein lies the genius of Western medicine, right? Well, you take your blood pressure, you see it's high, you go to the doctor, they take your blood pressure, they see it's high, and then the genius manifests on the piece of paper, writing a diagnosis which shows the big understanding of Western medicine. And they write something like, blood pressure, which is, you know, third degree high blood, essential hypertension. Third degree essential hypertension, just an example, right? Just an example. And of course you read that and you say, oh, okay, now, obviously written by an expert, right? Because you didn't know that you had third degree essential hypertension, okay? And of course you're going to get some pills and so on and so on, okay? And you take the pills, right? And you ask your doctors, oh, how long do I need to take the pills? Oh, forever. But maybe I'm just, I don't know, 30 something. And maybe I live to be 80 something, right? But what about, you know, it's like 50 years until maybe I die. Then 50 years you take the pills, right? But why? Don't they, you know, tackle the blood pressure? I mean, I thought when you wrote it down, you understood what it was. You know, why is it happening? Why is it? I mean, what actually does it mean? The essential part, right? It's like essential high blood pressure. Do you know what I found out? Essential is one of those words which is like a code word. It means unknown cause. Yeah, you heard it right. You heard it right. And I couldn't, when I heard this, I couldn't believe it. I felt so betrayed. I felt so betrayed by what I thought had been this magical science that explains everything. Or so I would have loved. I knew it didn't explain everything, but this was a little bit like cheating, right? I mean, I felt like if I, as a future doctor, don't understand the process, I might as well be honest with the person and tell him, look, we don't understand what this is. We don't understand what the cause of your disease is. Instead, what happens is that we hide behind big pompous sounding words like essential high blood pressure. Because, you know, let's face it, as a patient, you do need the comfort, right? And this is, I'm not criticizing the doctors. I'm criticizing the system. Right? And the system is not only just the doctors. The system is also entailing the patients, right? Because in this system of doctor-patient, it's like the doctor is somewhere high, right? It's like the ultimate authority, and the patient is somewhere low. The whole responsibility comes with the doctor, and the very little responsibility comes with the patient. Now that, again, is wrong, right? Because then the patient behaves like a little child, and the whole authority and responsibility lies with the doctor. And the doctor is a little bit overwhelmed because our Western medicine does not understand all these things. But the doctor, as in the parent, cannot tell the child, as in the patient, hey, you know what? We actually don't know what's going on, because he'll freak out. And guess what? He'll go to another doctor, who the other doctor will say, no, oh, no, don't worry about it. Just take these pills and you'll be fine. Does the other doctor know better? No, he does not. or she does not. Yeah, it's just the comfort, the need for comfort that is different. And this need for comfort when we're anxious about being sick is so big that there was enormous pressure on the medical side to invent these kinds of words like essential. It's like one doctor talking to another, you know, do you know why this guy has this disease? No, well, fuck all. I don't know either. I don't know. Let's just give him some pills and, you know, hope science comes up with something better. You know how often this happens? It happens so often that we need synonyms in Western medicine. It's not enough to have just one word, because it would kind of sound repetitive if we always had all these things. To call them essential would kind of trigger some question marks. You know, why do we call them all essential? And someone would come, oh, well, let's look it up. Oh, unknown cause. What the fuck? So, no, we have other words too, because, you know, we need a whole vocabulary to actually, you know, dump people up. And the other word is called idiopathic. Right? Maybe you haven't heard this one because, you know, who knows? So idiopathic, whatever, right? Idiopathic blood pressure means pretty much the same bloody damn thing. We have no clue what the cause of it is, right? Don't you feel safe now and well taken care of? But the funny thing is, with so many diseases, so many diseases, not having a known cause, Western medicine actually, in the latest craze, actually has pretty much abandoned even these two words. They, most of the time, don't even bother to put the words in there for the sake of it, because, you know, again, even if it's just two words, it would still be repetitive, right? And I'm going to give you a whole different example. Right, from the very wonders of Western medicine. And again, I'm just going to come back to it because I know it sounds like I'm criticizing Western medicine. Actually, I'm not. It doesn't sound like it. I'll explain myself a little bit later on. So just bear with me. The other thing is that, like, let's you know, when did actually Western medicine start? Western medicine, we can, you know, say it actually came into being with the invention of antibiotics, right? Because before antibiotics, we didn't actually have what we would today recognize as Western medicine. Of course, we didn't have many things before. We didn't have ultrasound, we didn't have x-rays, we had nothing, right? But when did the first antibiotics come into being? Well, 1929. Oh my God, not even 100 years ago. Not even 100 years ago. So, for a system of medicine that is barely 100 years, like historically hasn't actually even been born yet, right? It's like the blink of an eye. Western medicine has gone an extraordinarily long way. We understand an incredible amount of things about the human body. But let's make things clear a little bit, right? What is absolutely amazing are the things that we can do despite the short duration of, you know, of the lifespan of you know, how long Western medicine has been into existence. I mean, for 95 years, we know an amazing amount of information. But compare that to what is to be known so that we are effective in treating something, it is so little. It is so little, right? And when you actually, as a person, become sick, it won't be enough for you to feel, oh my God, you know, Western medicine is incredible. Is it good for my disease? No, but who cares? You know, it's grown so much in the last 100 years. Who cares about history when you have a disease? You want it to be gone, right? So when you do have an ailment, when you do have a disease, you want it to be gone. Now, in order for it to be gone and stay gone, you need to understand what's caused it, right? Now, one of these major advantages of Western medicine is antibiotics, because the introduction of antibiotics has made the difference between life and death, literally, for billions of people. Now, this has been one of humanity's biggest wonders, and I'm not belittling it at all. I just want to underline what happens despite the wonder. When you treat, let's say, a urinary infection, right, a urinary tract infection with an antibiotic. Maybe it's happened to you, maybe you know someone that's happened to, right? And so you get the symptoms, you get the dysfunction in the urinary tract, you know, the discomfort and all that, and then you cannot pee, and it's very, very annoying, and it's very unpleasant, right? And you go to the doctor, and they prescribe antibiotic, and guess what? Poof, it goes away. The wonders of Western medicine. Wonderful. You wait for a month and it comes back. What gives? So you go to the doctor again, right? So what happens? So, well, they do, you know, various tests and blah, 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 and you get another round of antibiotics, and poof, 3 days later, you're all just nice and peachy, and everything is great, isn't it? Until another 2 months later, and it pops back up. So then it kind of gets annoying, right? And then the deeper questions start. Why does it come back? Because you see, we think in Western medicine, we're conditioned to think that we know. At least, I mean, we don't know a lot of stuff, but this we do know, right? We do know that bugs are bad. Bugs, microbes, viruses, all these are bad. These are the causes of the disease, right? Wrong. Wrong. And I can tell you this from the perspective of Western medicine, right? I mean, Western medicine as a science is the provider of arguments, of reasons, right? Why it actually, does not make sense. And I'll tell you why, right? Say, for example, we take this approach. Okay, so the cause of disease is within, is coming from microbes, it's coming from bacteria. Let's say it's coming from bacteria. So the theory is we get sick because there are bacteria in the environment. We don't get sick when there are not bacteria in the environment? Maybe? No, because actually the environment always has bacteria. Wonderful, we have an immune system. Yes, that's going to really rip them apart. It's going to tear through those bacteria and it's going to keep us safe. Does it do it? Yes, it does. Then why do we get sick? Because there are bacteria, but we do have an immune system which fights bacteria and viruses and all that. And sometimes we need the help of antibiotics. So then the question is, why? Why do we need the cause of antibiotic, or the help of antibiotics? It doesn't actually make sense, does it? Right? I mean, kind of the theory breaks down. Why do we get sick? Why, for such a long time, I've never gotten a urinary tract infection, and then I get urinary tract infections, and they don't go away until and unless I take antibiotics. They go away with antibiotics, and then they come back. And then they keep coming back, and they keep coming back, and they keep coming back, and then it becomes chronic, right? Now, how does Western medicine handle chronic stuff? Well, it doesn't, right? You'll get the same antibiotics again, and again, and again, and again. Right. This is where the theory breaks down. So when I found out all about this, I was underwhelmed, to say the least. I was disappointed, and I felt, I felt that it was betrayed, and I was raging against Western medicine. Now I've cooled down. I'll come back to this, right? I'm not against Western medicine. Actually, I use Western medicine, I recommend Western medicine in some cases in parallel with other forms of treatment. We just need to understand what the aim is with each and one of them, right? Now, of course, yes, there's a whole dark side to Western medicine. There's a whole, profit to be made by, pharmaceutical companies. But, put that aside. They do work and we do need them. When we do want to manage the symptoms, right? The only thing is we need to understand that we need to separate symptom management from causal, from addressing the cause, right? Because when we need to address the cause, we want to make sure that that disease doesn't come back. Let's take, I don't know, the common cold, okay? You have a cold, or I have a cold, okay? What do you think? I don't take things for cold. I don't take any ibuprofen or aspirin or paracetamol. I do, right? Again, I'm not against Western medicine. Please make sure you hear me. I do not encourage you to not take your pills that have been prescribed by the doctor. What I do encourage you to do is take your health and your life into your own hands, not by prescribing yourself various medications. By the way, you can't, but let's say that you did. That's not the point. That's not what I'm encouraging you to do. I'm encouraging you not to leave the whole responsibility of the process to the doctor, because you need to take ownership of your problem, okay? Do you need to be a doctor for that? No. Because as I said, Western medicine can only go so far. But you need to go much further, right? You need to understand what your body is talking about. Why did you get that disease? And why is it happening? And why is it happening now? And why is it happening to you, right? What can it correlate with? And you need not to become a therapist or a doctor, but you need to ask the right questions, and you need to look for those professionals who ask themselves these questions on your behalf with their knowledge and understanding, which is kind of professional. You're never going to get there unless you become a professional yourself, which takes years and years and years and years and years. But you need to find a therapist that has the right approach and is genuinely interested in finding out what's going on. The problem with all this is the hedonistic approach, which is present even in alternative medicines. Let me tell you another story. For the first, I think, 10, maybe more years of my career, I was rallying against disease and against suffering, end all suffering. I was wrong. I realized that actually, suffering, it doesn't feel nice, that's the definition of it, right? But actually suffering carries a message. Suffering is telling you, hey, you have a problem. You might not be aware of the problem, you might want to ignore the problem, but you know what? You have a problem. I have come to understand that actually suffering is a kind of degree of friction between yourself and the flow of the universe. I know it sounds a little bit like hocus pocus, right? But listen, just think about that for a little bit. I'll say it again. I've come to understand that suffering is a kind of degree of friction between you and the flow of the universe, right? So basically, things flow naturally in a certain way. If you don't flow with them, then at some point you might become sick, right? You're not in the flow. Now, some of you that might say, oh yes, that's so nice. To others, you might, well, what the hell is this guy talking about? The problem is that we sometimes get so lost in the idea of erasing suffering, because when we suffer, we become a little bit like small children and we don't think straight anymore, right? We get tunnel vision, and the only thing we can think of is how can I make it end? How can I erase all this suffering and just, mommy, please make it good? That's not going to solve your problem. You need to grow the fuck up. You need to have a bigger picture. Because if you don't have a bigger picture, then you will be a victim of systems that don't have a bigger picture either, right? And you won't be any better in your health. You might, consume large amounts of pills and, go through enormous amounts of tests and whatever, and spend incredible amounts of money without any benefits. Now again, please make sure I am not against blood tests or doctors or anything. I'm a doctor as well. I am a medical doctor, and I do think that Western medicine has very, very clear purpose when it comes to surgery, when it comes to symptomatic treatment, when it comes to very specific areas in which it does wonders, and it should be bloody well appreciated for what it does. But in some areas we give it too much credit. In some areas, we shouldn't actually focus on the medicine, we should focus on the patient. Because what I've come to realize is that the first step in healing is for you, the patient, to take responsibility of your problem. You need to make sure that it's you who is responsible for finding out what the is going on. Okay? It's your responsibility. Again, I'm not saying you become a therapist. I'm saying you need to have that very clear intention to seek out the right individuals, as in therapists, who have the right approach. Now, I've been just going on and on and on and on about the whole thing, and you might be thinking, why is he just going on and on and on? It's like going around in circles. He's just said this one thing. Guys, I cannot overestimate just how deep this problem goes. And you might be thinking that you go deep enough, but you might not. Because you know what? There are so many alternative therapies that are not Western medicine, and they pretend to go deep. But actually, they're just as symptomatic as Western medicine. Perhaps without even being scientific at all, right? Now, you just need to ask the right questions. Basically, in this video, I'm trying to teach you how to think and what to ask, right? The questions derive from the thinking. So basically, the question is, how deep does my therapy go? How deep does the understanding, my understanding and the understanding of the therapist that is treating me, go for this particular disease? Why is it happening to me? What change do I need to make in my life so that this goes away? I'll give you a very, very simple answer to all this, or actually a procedure. The procedure that I use with all my patients every time, all the time. Let's say you come to me and you say, hey Octavian, I have this problem, blah, blah, blah. And I ask you, so when did it start? So it started, I don't know, in 2019. Okay, so what was going on in your life in 2019? Well, what do you mean what was going on? Well, did anything happen? Did anything that had an emotional impact happen in that period? Maybe. Maybe not. I can't remember. How about 6 months before? 8 months before? In that time frame, right? Anything of impact? Oh, wait. I broke up with my boyfriend. I broke up with my girlfriend. Oh, my mother died. My horse died. I don't know. Somebody. Something. I had a really stressful period at work, and that was exactly when my wife was, I don't know, giving birth or something, right? I don't know. 80% of the time, the people, when asked these questions, which you can ask yourself, identify something. And why is it so easy to identify these? Because this is not a mystery. It's just that Western medicine, if Western doctors were to ask these kinds of things, the system in which they practice medicine doesn't have something that it can work with, right? Because let's say, Western medicine knows very well that some diseases, let's say you have an autoimmune disease, right? Let's say you have, I don't know, you've developed autoimmune thyroid, okay? And when did this happen? In a period of high stress. That's little relevance to Western medicine. It's well known that many diseases are triggered into existence by various emotional stimuli. Western medicine knows that. It's very well documented scientifically. How do we use this information? In Western medicine, we don't. That's the issue. In Chinese medicine, we do. Why? Why the difference? Because in Chinese medicine, let's say we ask these questions and we come to the conclusion that, I don't know, you stepped out of a relationship which was quite toxic, and there was a lot of stress and a lot of turmoil, and it was, a very difficult breakup, right? And this was the cause of your stress. That translates into some things. That translates into emotions. That translates into various emotions that actually have a corresponding organ. In Chinese medicine, we have correspondences between emotional spectrums and organs. And then we have meridians and points that address those organs. You don't want to do blood tests for those. I mean, if let's say the emotion was sadness because, I don't know, your mother died, okay? And it was overwhelming how much sadness there was. What are you going to do? Well, sadness affects, let's say, the lungs, right? That's the main spectrum, although it can have a lot of ramifications. You're going to have an X-ray to the lungs. Useless. It's not going to show up anything, right? Or let's say there was a lot of stress and anger and frustration, right? That affects the liver. You're going to do some liver blood tests. What do you think they're going to show? Not much. Maybe a high level of cholesterol, but that's about it, right? So my main idea that I want to pertain to you is this. You need to be concerned with the cause. And you need to boldly go with the deepest therapy that you can find, that goes to the deepest level that is possible. Why? Because you need to go beyond the level, or at least at the level of the maximum depth of the disease. Because let's say if this is 0 and the disease is at this depth and you only go at this depth, what's going to happen? That's going to be a symptomatic treatment, right? You go a little bit deeper but not as deep, it's still going to be symptomatic, right? The deeper you go without addressing the maximum level of depth where the disease is, what's going to happen is that you're going to treat part of the disease but not the root. If you don't treat the root, what's going to happen? Well, what's going to happen is that you're not going to be effective at eliminating it once and for all. And it's probably going to come back, right? Or if it doesn't come back, this is the thing, right? This is one of the things that Western medicine does not grasp, but Oriental medicine does. It may not come back as the same disease, because we can have the same root but different manifestations. So maybe you get rid of, I don't know, hepatitis, but you get migraines. You get rid of migraines, but you get digestive problems, right? Maybe you treat the digestive problems and you get depression. It's like, a game of whack-a-mole. But it's the same root. It's the same thing. And if you don't get deep enough, you're not going to make it go away. So that's one reason. It sounds a little bit like, not a very happy, jolly episode for, a podcast, right? Well, no, actually it is. Because there's a very, very good news at the end of this. The very good news is that if you do have the right attitude, and again, the right attitude is that you need to go as deep as you go. Right, very, 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 very deep, because you want to make it to the deepest level so that you cure it there and it never comes back. If you do use a method that is like, for example, Chinese medicine, but the emotional kind of Chinese medicine, not just the physical kind of Chinese medicine. Chinese medicine also has layers and layers, right? The best kind of Chinese medicine addresses the whole, meaning body, mind, emotion, and spirit. Many acupuncturists just treat the physical, because, for example, a lot of acupuncture practiced as it's practiced now in China only goes as deep as the physical level, and it's good for physical level stuff. I mean, if you have, I don't know, just a slow digestion, maybe it's good enough, right? If you have a low back pain, maybe it's good enough. If you want to treat anything deeper, it's not going to cut it, right? It may be good for a few months, maybe a few years, but then things are going to come back. But the additional bonus for going deep enough is that the biggest rewards come from somewhere that you don't even expect. Right? People come to therapy because they want to get rid of disease. That was the rule before. Now, luckily, things have changed. Luckily, more and more often, I meet people who understand already that their disease is actually much more than just raw suffering. It's not just like, you know, the universe has an imperfection, or the universe is just bad or sadistic with you and it wants you to suffer. No, the universe is actually sending you a message. And it's not because it has a personal relationship with you. It's because the universe has a flow. And if you're out of that flow, you're going to sense friction. And that kind of friction is, one way of feeling it, is suffering. So basically, suffering is not just senseless suffering. Suffering is also a message. It's a message that, hey, you know, I need to learn something. So what do you need to learn? Well, that is where the journey starts. But where the journey ends, that's the best part. The journey ends for each step of the way with development, emotional development, spiritual development, new perspectives, new ways of seeing things, new ways of understanding things, new levels, newer variations. Let's say firmware updates, to be in the 21st century, right? Firmware updates of your emotion and spirit. You become a better version of yourself. You live life at a whole different level. It took me 10 to 15 years to get to this understanding. I've been, you know, this valiant rider against suffering. Well, guess what? I have made my peace with suffering, because I've seen that people with the right attitude, they suffer very little, because they ask the right questions pretty soon in the process. And if you ask the right questions pretty soon, you don't actually have time to get out of sync with the universe too much. Because if you ask the right questions, you'll get some answers, and those answers will enable you to get back in flow, and then the suffering will diminish. Therefore, people who ask the right questions and are sensitive enough and have the right attitude, understanding that suffering is just a messenger, they get less suffering. Because as soon as something happens, then they understand, okay, I'm doing something wrong, I need to shift back to that. Right? The right understanding keeps you away from suffering before it even happens. That's the best prevention that you can have at all, right? So that's my message to you. Ask the right questions, because not only does this process entail for you to become free of your suffering, the best benefits, the best bits, are through a transformation of your soul, of your perception, that you cannot even start to grasp. When I talk to patients that have been in therapy for a number of years, whatever they came for, we look back together on their journey, and that's the moment of my greatest satisfaction when I'm on this journey with them. It's like I get goosebumps right now, because we look back and we see that the biggest, most worthy of remembrance parts are not the symptoms that brought them to therapy, were not the suffering that got them into the process, were the benefits of the transformation within the process. You know that saying, which is so cliche, right? It's not about the destination, it's about the journey. But this is so true. This is so true. It's because it's not about the lack of symptoms or disease or suffering. Yes, you'll get that too. But at the end of the rainbow, what you'll remember and what you will be most grateful for is not the lack of suffering. Because the lack of suffering was there to begin with, before the suffering actually began. What you will have at the end of the journey, where you're back where you started, meaning without the suffering that you had, is what you gained throughout the journey. And what you gain throughout the journey is a deeper perspective, is a whole new level of transformation, which now enables you to understand why you suffered in the first place, what understanding you were missing that made you out of sync with the universe. And that is priceless. You won't get that through pills. You will get that through deep, deep therapy. So try and go to the deepest therapy that you can find, and by all means stick to it, because it's not an easy path, it's not a quick path. The forte of this approach is not speed. It's very slow, but it's fucking deep, and you will love the way that your life transforms, because it will enable you to enjoy life at a level you cannot start to comprehend at this level. I hope you've enjoyed it. I'll see you in the next episode. And by the way, you know the drill. Subscribe, like, blah, blah, blah. And if you have any friends that you think might be could benefit from this approach, give them a share. I'll see you.